Oral cavity cancer is a common cancer, representing about 30% of cancers of the upper aerodigestive tract. Squamous cell carcinoma is the most frequent histological type. This type of cancer is particularly accessible to clinical examination, facilitating early diagnosis, and the diagnosis is confirmed by histological analysis. Treatment is mainly based on combined approaches, radiotherapy and surgery. Lifelong monitoring is essential to prevent recurrences and manage possible complications. This cancer mainly affects people aged 50 to 60 years, although it can occur at other ages in particular cases. Many factors increase the likelihood of developing oral cavity cancer. Excessive alcohol consumption is the main risk factor. When alcohol is combined with tobacco, the synergistic effect significantly multiplies the risk. This is explained by the irritating and mutagenic properties of these substances on the oral mucosa. A low socioeconomic level is associated with an increased risk due to limited access to dental care and a balanced diet. Malnutrition, particularly deficiencies in essential vitamins such as vitamin A and vitamin C, weakens the ability of oral tissues to defend themselves against aggression. Poor oral hygiene promotes the accumulation of bacteria and chronic infections, increasing the risk of cancerous transformation. Chronic trauma, such as that caused by misaligned teeth, poorly fitted dental prostheses, or repeated friction, creates prolonged irritation of the mucous membranes, promoting the development of precancerous lesions. Infection with the human papilloma virus, HPV, a sexually transmitted virus, is increasingly recognized as an important risk factor for certain types of cancers. This virus can induce cellular changes in the mucous membranes, increasing their risk of malignant transformation. Precancerous lesions are tissue abnormalities that have the potential to develop into cancer if not detected and treated in time. These lesions are divided into two main categories. White lesions, called leukoplakia. Leukoplakia is a white plaque that cannot be removed by scraping. It is particularly common in mild smokers and represents an important clinical warning sign. Lichen planus is a chronic inflammatory disease that affects women more frequently. Unlike leukoplakia, it is less associated with smoking. Florid oral papillomatosis is a rare condition mostly observed in women. It can progress to verrucous carcinoma. Secondly, red lesions, also called erythroplakia. Erythroplakia is often associated with a high risk of cancerous transformation. Oral cavity cancer can present in various clinical forms, depending on its anatomical location, progression, and histological characteristics. Each site has distinct features that influence diagnosis, treatment, and prognosis. The cancer of the tongue is the most common location. Nearly 75% of cases involve the free border of the tongue, an area particularly exposed to irritating factors. This cancer is highly lymphophilic, meaning it has a strong tendency to spread to regional lymph nodes. This characteristic often complicates management, as lymphatic spread can lead to recurrences or metastatic extension. Secondly, the cancer of the floor of the mouth. This is another common location, but its diagnosis is often delayed due to non-specific early symptoms. Lymph nodes enlargement or adenopathies are sometimes the first visible sign. In advanced stages, the tumor may infiltrate adjacent bony structures, thereby worsening the prognosis. Third, the cancer of the inner cheek or buccal mucosa. The inner surface of the cheek is another site where cancer can develop. In most cases, a precancerous lesion precedes the development of cancer. This type of cancer tends to spread to neighboring structures, such as the tongue, the retromolar trigon, and the buccal vestibule, making management complex. Fourthly, the cancer of the retromolar trigon, a less frequent but particularly serious location due to its often late diagnosis. One of the most characteristic signs of this cancer is a limited mouth opening, a symptom reflecting infiltration of surrounding muscles and tissues. And treatment often requires mutilating surgeries, meaning operations that cause significant functional and aesthetic consequences. However, these interventions are essential to control tumor progression.